we're excited to announce that our podcast, The Table with Renee Da Silva, is evolving. We're introducing 3 new streams of content on this podcast, designed for Health System CXOs and hosted by the Health Management Academy's subject matter experts for health system nurse executives, health equity officers, and strategy executives. With this change, we'll be activating health system leaders towards outcomes and scalable solutions you can implement now.
Welcome to the Health System CXO Podcast, featuring 3 streams of content designed for health system nurse executives, health equity officers, and strategy executives. My name is Herleth, VP of Member Insights at the Health Management Academy, and your Nurse Executives host, discussing the issues that matter most to nurse executives, their leadership teams, and systems, and inspiring innovation across the practice and care continuum. Today, I want to talk about the nurse manager. And to put it bluntly, how many health systems are failing this group of leaders. Frontline clinical leadership is essential. And traditionally, we've looked to nurse managers to drive patient outcomes, high quality care, manage the biggest frontline workforce in the health system, keep margins in line, and handle patient and family needs. It is a big job and one that is growing. Because on top of the litany of day-to-day operations that frontline leaders need to excel at, nurse managers are now responsible for executing some of the most important strategic initiatives in healthcare. Things like stabilizing the workforce, piloting new ways of delivering care, and driving AI and technology adoption. Here's the thing. The nurse manager narrative, as I will call it, is well known. Nurse executives become more and more concerned about frontline leaders. They want to fix things like workload and burnout. And maybe they make some progress through management classes or fund unit admins to support the manager role. And then the conversation simmers down, resources are ultimately reallocated or cut due to budgets, and managers are right back where they started. I don't know if this is the marginalization of nurse leaders, a topic I would love to unpack on a future episode, or if it's something else. Regardless of the root cause, it needs to change. And so, across the next 2 episodes, I want to unpack how health systems are failing the nurse manager. Today, we'll dive into what is perhaps the longest standing discussion in nursing leadership, and that's nurse manager span of control. I want to address this topic head on by exploring recent, compelling data on the state of nurse manager workload. Because if we don't get workload under control, we can't expect nurse managers to be the transformational leaders we want and know they can be. And honestly, without workload rationalization, nothing else really matters. And then in part 2, we'll talk about the need for leadership development. There are incredible, hardworking, talented leaders at the front lines who want and crave concrete management and leadership skills. And it's a failure on the health system's part if we don't invest in developing that raw talent. Because leadership is not an innate quality. It is a skill, and it must be taught. So let's get into it. Span of control recently came back into the spotlight in part due to emerging evidence from AONL, industry partners like Laudio, and recent benchmarking from my own team, Nursing Catalyst. I'll share more on those findings in a moment because the data are compelling. But for the next few minutes, I want to address appropriate spans head on and hopefully do 2 things. First, equip all nurse leaders with the data to tell a more compelling, rock-solid case for why spans are too big. And this requires changing how we are talking about span of control. The second is to change the discussion around implications of doing nothing with spans of control. Traditional implications, things like manager burnout and turnover, they matter. But to date, we've seen little change using this narrative. So we need to rethink the message here and talk about how manager spans are impacting overall health system strategy. And if you're listening to this and you are not a nurse leader, welcome. I'm so glad you're here. I hope this helps you and your team re-examine the nurse manager role. Okay, so let's get into some of that data, starting with the punchline. Nurse manager spans are not appropriate. Yes, I'm sure somewhere in the world there is a nurse manager with a reasonable span of control, but it is not the norm. And now we have updated data to show this in concrete terms. My team, Nursing Catalyst, benchmarked span of control at the end of 2023 using a tool that measured total workload across 20 variables, including headcount. Healthcare leaders typically use direct reports as a measure for span of control, so I'm going to start with that. Because on average, 45% of managers have more than 70 direct reports. and nearly half of that group clocked in over 100 direct reports. That data alone should clue us in that the nurse managers are not being set up for success. But to date, these types of numbers haven't influenced unit leadership structures, which we know because frontline nurse leaders continue to be the only leaders with such large numbers of direct reports. So here's my first suggestion. We need to stop using headcount to quantify nurse manager span of control. The headcount argument isn't getting us anywhere, and that's in part due to the fact that there's no evidence-based standard for ideal manager headcount. But more importantly, this narrow definition is insufficient to measure the full scope of manager responsibility. While the number of direct reports a manager oversees does have a significant impact on their workload, headcount does not take into account other management responsibilities, such as pilot implementation or other leadership tasks that contribute to overwork. So if we don't use headcount, then we need to access a better, more comprehensive data set, which now exists. So let me quickly walk you through the recent benchmarking work from Nursing Catalyst, which is also linked in our show notes if you want to see the full version. My team surveyed over 1,700 frontline managers on their total workload using a tool that measures 20 variables within their work environment that impact their workload. We also collected demographic information and unit leadership structure data. I don't have time to walk through all of the results in detail, and that would be a lot to absorb while listening to this short podcast. So here's what I'll call out. When we look at a more holistic measurement of span of control, we found that on average, nurse manager workload is correlated with about 50 hours of work a week. This means some managers have a workload that is consistent with expectations of any leadership position, 40 to 45 hours a week. But these scores also indicate that decades-long challenges with nurse manager overload persist today because 50% of managers are working at least 50 hours a week on their unit. And if we look at the top 25% of managers, their workload is truly unsustainable. That top quartile, with the highest spans of control, are consistently putting in 65 or more hours a week. And I think we can agree that 65 plus hours a week is not sustainable for anyone, but particularly for those in roles where they are not compensated, like CEOs. There's a lot more data to dig into here, and that includes the biggest drivers of total workload. Remember, we looked at 20 variables driving workload, and our analysis allowed us to force rank those most impactful variables in a statistically sound way. Some of the top variables are not surprising: headcount, number of beds on the unit, turnover rate on the unit. Others, I think, help tell a more interesting story. For example, time spent on risk management and number of process improvement and pilots on a unit, as well as the number of novice nurses on the unit, were all in the top 5 as the most impactful variables on total manager workload. So what does this mean in practice? I mean, there is definitely an interpretation that it means that risk management went home during COVID, and now managers are doing most of the investigation work. It also means that changing workforce dynamics, including the noviceness of the workforce, is not only a quality and turnover concern, it's a major driver of manager workload. These data are powerful because they help us understand what is driving manager workload and hopefully what we can do to intervene and rationalize. There is a lot of great other data to unpack here, and I will happily share the full detail and the full report with anyone who wants to get into it. Just reach out to me on LinkedIn. For now, I want to move on though and talk about the cost of doing nothing about manager workload beyond individual burnout and turnover, because I think I've established that nurse manager overload is a real thing. One of the best ways I can bring the health system impact to life is to look at managers with the greatest risk of overload. Those who are in the top 25% of span of control, who are working more than 65 hours a week. To contextualize, these managers are responsible for the greatest number of staff. On average, they have more than 100 direct reports. But what the data also now show us is that these leaders play a disproportionate role in advancing health system priorities. And the data point that we looked at was around how many pilots a year they're running. So this group, the managers in the top 25% of total workload, were on average running 10 pilots a year on their unit. That's almost one new pilot a month, with more than 100 direct reports while driving outcomes and stabilizing margins. In other words, it's managers who are executing health system strategic priorities, and it's basically side of their desk work because they already have a full-time job. And if health systems intend to successfully pilot and scale care delivery innovations, Executives must refocus their leaders' priorities to do so effectively. So, what's our strategic plan here? First, we need to acknowledge that this isn't just a nursing issue, it's a strategic organizational challenge. We need to invest in support systems, whether it's advancing technology, increasing admin support, or role restructuring. We need to listen to our managers. They're on the front lines and understand the challenges better than anyone else. We need to rethink our organizational structures. Do we have outdated models when it comes to unit leadership? We need to prioritize manager well-being as a key performance indicator. Their burnout is a leading indicator of larger organizational issues. And importantly, we need to create protected time for strategic work and leadership development for these managers. Frontline leaders are more than middle management. They are the backbone of our healthcare system. Investing in their success is investing in the success of the entire organization. So step one is rationalizing their workload. I hope you'll join me next time where we will explore another critical imperative for nurse managers, leadership development. Because even if we solve the span of control challenge, which is huge, we still need to ensure these leaders have the skills to drive transformation. And I'd love to hear your thoughts about this. What is your health system doing to support leadership? Reach out to me on LinkedIn or email me directly. Your insights could help shape the future of healthcare leadership. Thank you for joining me on the Health System CXO Podcast, where we activate health system leaders towards outcomes and scalable solutions that you can implement now. Remember to subscribe to the Health System CXO Podcast on your favorite podcast platform so you never miss an opportunity to hear more. And if you liked the episode, consider leaving us a review and sharing our podcast with your colleagues. You can also connect with us on LinkedIn by clicking the link in the episode description. See you next time.